Recently, my colleagues and I received an email from Human Resources about looking into the benefits of Medicare. And to be honest, it was not something I'd even given thought to because, in my mind, I always felt like I was too young. But guess what?
Many people think that in order to be eligible for Medicare, you have to be 65. And that is the primary consideration for people on Medicare. But in addition to that, people who have long-term disability, if you've been disabled through Social Security for more than 24 months, you are eligible for Medicare. And in addition, some people with some very specific disease classifications, things like end-stage renal disease or ALS may qualify you for Medicare as well. So there are more people who qualify for these services than just people who are 65 and over.
Kyle Moody is a Medicare expert and the Senior Vice President of Medicare Benefit Solutions. And with the Medicare annual enrollment period beginning on October 15th, he says now is the time for those eligible to focus in to ensure they get the coverage that they need.
It's really important that people start the process early and make sure that they have the benefits and offerings that they need going into 2021. Sometimes things change. Maybe your insurance company changed the prescription drug formulary. Maybe your doctor is no longer in the network. Maybe something changed with your healthcare and you need new prescription drugs, or you're looking for some other type of healthcare. It's really important that once a year, everybody look at the benefits they have, look at the needs they currently have and the needs they think they may have going forward, and make sure that they have a plan that fits all of that together.
So listen, I don't know if you know this or not, but this is an election year. And we have an administration that's been trying to knock down the Affordable Care Act. Should they get elected again? Right now, they're in the courts trying to strike it down. How would that affect Medicaid and Medicare if that is indeed something that comes to fruition?
The ACA in and of itself doesn't have a direct impact on Medicare, but it's a big topic of discussion. The one thing I can tell you is I've been in the business working in the Medicare world for 30 years. And during that time, there's been a lot of discussions around changes for Medicare. The good news is that, you know, the combination of what happens at the government level and what happens at the plan and the private level has always done something to make sure that Medicare beneficiaries have the best plans available to them.
Again, there are nearly 60 million Americans on Medicare who now have just over 7 weeks to review their coverage and change plans as needed during the annual enrollment period, which, by the way, begins October 15, 2020 and ends December 7, 2020, with coverage set to begin January 1st, 2021. For New Jersey News Network, I'm Phil Andrews.